According to the Ministry of Health, cardiovascular diseases are the second leading causes of death in the country, and hypertension is the most common cardiovascular disease amongst us, and it has become a great health concern in the public health sector. Well, today we are talking about hypertension, and I am here with Dr. Godfrey Ochieng, who is a clinician, and he is going to help us break down what is hypertension, how can we prevent ourselves from getting it. Welcome to the show. First things first, what makes the blood pressure go high?
So, as a start, hypertension being one of the cardiovascular related conditions is majorly a disease relating to heart and the blood pumping system. Yeah, and it's a two-way thing in that it can be etiological from the body system default, or it can be related to substance taken, like consumed by a person. So when we talk about hypertension, it can arise from various sources. When you consume something that can alter your body system, it can make the blood pressure to rise. Yeah, as we know it, many people call it blood pressure. They don't know the term hypertension majorly. Yeah, they just know pressure.
Well, so many people always want to know the link between hypertension and diabetes. Can you shed some light on it?
Yeah. Hypertension is not a lone ranger disease. Yeah, as we know, there is a interconnection between various diseases in the body. Yeah, and hypertension is linked to diabetes in that someone who has diabetes alters the blood vessels. There is a way it makes the blood vessels to calcify, harden. Yeah, and this causes the rise in blood pressure. Now that's how diabetes is linked with hypertension. So generally you'll have someone who has diabetes, he'll end up eventually developing hypertension because of the effects of diabetes on the vessels, which in turn causes an alteration of blood pressure. So that's how they are linked. Yeah.
So we have two types of hypertension, primary and secondary hypertension. What's the difference?
So for primary hypertension, it's related to external conditions, which can be genetic, it can be race oriented, yeah, and for secondary hypertension, it's majorly related to system, the body system, such as endocrine system, which is related to, we have the body hormonal system. Yeah, the body hormones have a role to play in regulation of blood pressure and also the heart conditions. Yeah. And according to percentage rates, the primary hypertension takes around 90% of occurrences, and the secondary is about 2 to 9%. Yeah, it's a rare one. So that gives us a hint that hypertension is more of a lifestyle condition. Yeah.
Now that you have mentioned it is more of a lifestyle condition, can one live with the symptoms of hypertension without knowing they're actually hypertensive?
Exactly. When we go to the clinical area, a huge chunk of people who come, they don't know they are sick. Yeah, most people get the diagnosis and they're surprised because they didn't know they are sick. Like they just came out because of certain symptoms. Maybe someone was feeling an headache and he just came to be checked. Yeah.
So when you say one can live with these symptoms without knowing that they're actually hypertensive, most of the times when you visit the hospitals, actually it happens daily when you visit a hospital, and the first thing they do is check your blood pressure. How comes you live with these symptoms and you don't know you're hypertensive, but when you go to a hospital with a stomach problem, they're still going to check your blood pressure, and you're not told you're hypertensive? How does that?
So when it comes to hypertension, okay, from a clinical view, when you visit a hospital, first you have to take your vitals for every condition. Any condition, any way you'll be feeling, you have to take your vitals, because vitals are very important in in treatment of every condition, yeah. But when it comes to hypertension, you can't diagnose hypertension using one reading of a single day. You have to come for like three different days, and they'll check the pressures. When they are constantly high on 3 visits, which are spanned on different times, like you can come maybe on a Monday, and then you come on a Wednesday and on a Friday, and then you get 3 readings which are high above the normal rates, then that can be diagnosed. But on a single day, you can't diagnose hypertension with a single reading, because a lot of things can cause blood pressure to go up.
Okay.
Yeah.
So considering the health complications that the symptoms bring, how long can these symptoms go undetected?
For pressure related symptoms, it's so hard to diagnose the severity of the conditions, in that the symptoms of the stage 1 hypertension is categorized in different stages. We have stage 1, normal, or first we have a normal blood pressure rise, which it's between the normal ranges, maybe a rise of about 10, yeah, and then there's the grade 1, and then the severe one is grade 2 hypertension, yeah. For the grade 1, you'll just feel these normal symptoms people feel, like headache, a light headache, yeah, you'll be feeling maybe some chest pain, which can be confused like a chest sickness or something related to that. So it's normal that you'll feel like I'll just go to a pharmacy, I'll get some painkillers and go home and I'll feel okay, yeah.
So reports from the Ministry of Health, actually it's that hypertensive cases are going up. Is it because we don't come for checkup, or there is something else?
Now, according to the last data we had from the MOH stated like we have around 25% prevalence rate of hypertension in the country, and it's tied to an awareness. Unfortunately, the information is not so much out there. Many people don't have information concerning hypertension, yeah. Lifestyle. People get information when they are sick, when they come to the hospital, and the diagnosis when they'll start checking on it, like, what is this thing I've been told I have, how can I live with it, yeah. But people are not that well informed, yeah. And in the healthcare domain, there are four stages which are focused on. We have the preventive at the stage 1, which is at the community level. We have the promotive, which is also at the community level. Then we have the curative, which it's now the hospital level, and the rehabilitative, which is also part of the hospital level and community level, yeah. But now the first two, the curative and promotive, which are aiming at preventing people contracting hypertension, living healthy standards of life, yeah, are not majorly focused on, yeah, because it's also hard at the community level. It's hard to mobilize people, to teach them, because there is a lot of things people go through. So it's hard for them to also put these practices in their daily routines, yeah.
So when you say that, does it mean someone who's hypertensive can be in denial and say, I am not hypertensive?
Sure, I can say a yes and a no, in that for the yes side, for somebody who has been diagnosed, it's more of psychological. Anytime you go to a hospital and you're told like you have this condition and it's a lifelong condition, like it's irreversible, obviously you'll have that feeling of, maybe these guys are not telling me the truth. Maybe they are cooking this up, or they are not sure. So you'll start walking, trying to get confirmations. Yeah, denial is part of psychological way of accepting the realities of health.
So when someone is in denial, but then eventually they get to accept their condition, how do you follow up when it comes to medication?
Now, the guidelines for managing hypertension, there is a guideline which is being used, I think internationally. Also in Kenya, there is a guideline. Like when you receive a patient, when you diagnose a patient, you have to put him or her on record. She has to be a client to that hospital. Regular visits, they have regular visits where their blood pressure is always checked, and their drugs, because the drugs are also dynamic in that they change. What you have this month maybe can be changed at a certain date, because there are also changes in the system, which maybe it's kidney which now is faulty. They have to give drugs which are working in relation to the normal system function of the kidney. If it's heart related, they give you drugs which are related to the functions of the heart. So it's they'll keep on, like you have the regular visits, they check on you, they do follow-ups. They do follow-ups because if you walk to any cardiology clinic, they know their clients, they know the dates, they have the records. Like in a hospital, they have all records of the clients who come. Those who've been treated successfully. Hypertension can be treated, it can be reversed. It's not a death sentence. Yeah.
Nice. So before we even go into details about hypertension, give us some of the risk factors.
The risk factors. One, we said it's a lifestyle. And lifestyle. We'll sing it again and again, again and again.
So when you say lifestyle, does it mean the food I eat, where I go?
Exactly. What you consume, how you take care of yourself, what you consume. By what you consume, I mean salt. Salt is one of the dangers of hypertension. Yeah, salt triggers a lot of blood pressure, inconsistency. Number two, weight. Your weight determines how your heart beats a lot. Yeah, because if your weight is not monitored, the fat levels in your system will always cause your heart to work at a higher rate than the usual one. Yeah, I know you've seen those people who are those people who have weight issues. They can't do even a simple exercise like maybe 5-stair. If they do that, they are panting. That already puts you at a risk.
So when you talk of what I eat, and you have mentioned salt, now in my diet, what should be more and what should be less?
Your diet should be more of potassium products. Yeah, you should take more of potassium because the heart utilizes potassium more for its function. Yeah, and it's one of the recommended. You can reduce on fats. Yeah, junk food, you reduce on that. Yeah, and you consume more vegetables. Yeah, they are always good for the system. Yeah, and number one is salt. You reduce on its intake.
Okay.
Yeah.
So at some point you mentioned it can be genetic. So when you say it can be genetic, how do I prevent myself? Because probably my parents, one of my parents, like my mom or my dad, is hypertensive. I am more likely to be hypertensive. How would I prevent myself not to be hypertensive? Because I don't want that thing to follow me.
Now, when it comes to genetics, it's one of the hardest things to regulate, in that you can never regulate a gene. The only way, when you have a history in the family of hypertensive people, maybe an uncle somewhere is hypertensive, an aunt, and then your father, what you can do, you can always encourage maybe the offsprings to visit hospitals frequently, get themselves checked, so that it can be noted early if there is an inconsistency in their blood pressure.
Wow.
Yeah.
So is there a connection between stress and mental illness to hypertension?
Yeah, stress is also a major cause of hypertension. Yeah, because the system has an optimum level of operation. Yeah, when you're operating at a stress level, your system is trying to. There's a lot of stress also on the system. Yeah, your heart is also operating on. It's trying, like, your whole system is operating on stress. It's not just a mental thing. Your whole system operates on stress. Yeah, so it puts you at a risk of starting to have these inconsistent blood pressures, and it can lead to a lifetime change in your blood pressure. Yeah.
Wow. So uncontrolled hypertension comes with various complications if it's not treated early. So what are some of the complications?
I'll start from the minor ones as we move to the major severe ones. The minor ones, we have the headaches, the chest pains. Yeah, you'll feel them regularly. Maybe weakness, general lethargy, the weakness we have. Yeah, you'll feel some weakness. At some point, it can affect your vision to a point of blindness. Yeah, because blood pressure is very little. The eye is dependent on the pressure of the system, of the whole body. Yeah. So when your pressure goes unregulated, it can affect your retina and can cause blindness. Yeah. Another part is you can have stroke. That's related to now your brain, because your brain also receives blood from the heart. When the pressures are high, there can be stroke, because they can either a blood vessel in the brain can rupture and cause stroke. Another one is infarction, myocardial infarction, which is your heart to abruptly stops beating. Yeah, which will generally cause death. Yeah. Now those are the severe ones. Those are the end stage ones. Like when you get to a point of infarction now, it's kind of late now. Like you've lived with a high pressure maybe for a very long time.
So change of lifestyle, what is imperative?
Okay, change of lifestyle. As we usually encourage people, maybe you can start by having regular exercises. Yeah, an exercise a day keeps the devil away. We can say that. Yeah. Yeah, you can take a walk. You can go to the gym. Nowadays we have various workout places where you'll get instructors, and those instructors also are educated on what you can manage. Yeah, so it helps you reduce the heart activity. That's why we emphasize more on exercise. It reduces the heart activity. Yeah, and keeps you safe generally. Yeah. On dieting, yeah, you can visit a nutritionist. Yeah, who can assist you have a proper plan on what you can consume, which is healthy for you, and that which is not healthy for you. On lifestyle again, tobacco use. Tobacco use. Tobacco is one of the risk factors of hypertension. People who smoke, they are like twice at a risk of acquiring hypertension. Yeah. Alcohol and hypertension are one thing. When you take alcohol increases your body calorie. Yeah, and calorie, weight. Alcohol, calorie, weight, hypertension. You get the cycle. Yeah. So many people are always like, why are you guys against alcohol, against tobacco? Because maybe it's never stated out there, but a number of patients who are hypertensive, they have a history of either alcohol or tobacco. Yeah, so these two should also be done away with.
So a question comes up of in hospitals, do you see more of men or more of women coming who have accepted they are hypertensive? So do more men come for treatment, or it's the women who come for treatment?
In our environment, in our society, men are linked to the survival that survival mentality. Yeah, a man will only visit a hospital or see a healthcare professional when he's almost down. Yeah, when this thing is getting toll of him. Yeah, is when he'll come. Yeah, but for ladies, a slight change in how they're feeling, they'll come and seek for that care. Yeah. So you'll find men will only come when maybe after diagnosis they'll be consistent because now it's a serious thing. Yeah, and they are not that regular. They're not that regular, honestly. Yeah.
So an interesting question. On the side of men, how do you get to counsel men who say probably are a 20-year-old person who's been diagnosed, oh my God, that he is hypertensive.
Yeah.
But then, at the same time, you have to tell them of the side effects that comes with the drugs, because now they're going to be on a lifelong medication. And at the back of their minds, they're like, this thing is going to affect me sexually. How do you handle such cases?
So when it comes to hypertensive drugs, they are in categories. Yeah, and when I talked about guidelines, protocol of managing hypertension. Yeah, you don't just pick a drug and give. First, you have to check what is related to this type of hypertension. Is it a kidney? Is it a heart? Yeah? Is it hormonal? Yeah, is when now you'll prescribe a drug which is related to that specific cause. So any person who goes to a clinical setup to get treated for hypertension, it's a thorough procedure. It's a thorough and a monitored procedure, and there is no drug which doesn't have a side effect. Yeah, anything that alters the body function generally has a side effect. Yeah, and it can be regulated. Maybe the dosage. Yeah, and erectile dysfunction is one of the side effects of hypertensive drugs, but we rarely see it because of how the dosage is being spaced. Yeah, you give that which can be the body can contain. Yeah, so dosage is one way of minimizing the side effects. The regular follow-up, like when we give you a drug this time and you come and report of it affecting you, they'll look for another drug which doesn't have the adverse side effects you are facing, so that has to limit on the discomfort you are receiving from the drugs. Yeah.
Nice. So as we wrap this up, give us your clarion call when it comes to hypertension.
To our viewers now, as we said, hypertension is not a death sentence. Yeah, you can live. People live. We have clients who live. We lose very few clients to hypertension. Yeah, and you can visit. I'll encourage you to visit healthcare points. We have various points for the regular health check, where they do BMI, they do blood sugar test, hypertension. Nowadays they are free. They are free. When you walk to a hospital, it will be done for free. Yeah, they won't charge you. When you go to the pharmacies at your residential areas, they can take your blood pressure. Yeah, it's you don't need to wait for you to feel the discomfort of either headache or what to go get checked for that. You can make it a habit of having regular health checkups. Yeah, it can assist you a lot in getting early diagnosis. Maybe if you are having early stages of hypertension, yeah, you can visit a healthcare facility when you have the slight symptoms, maybe headache, you're having eyesight problems, you're feeling some chest pain. Visit a hospital and get yourself checked. When it comes to your health is your wealth. Yeah, these things we are talking, these small things we are mentioning here and there about your dieting, exercise. Just do them. It's for your own benefit. Yeah, it will cover you a lot. We know the cost of health now in our country. Yeah, health has now become very expensive, and preventive is better than curing. Yeah, if you can prevent, it will assist you a lot, yeah, than curing. So just have a good check on your own self. Visit hospital frequently, have yourself checked, and yeah, help us eradicate this.
Wow, nice. We've been talking about hypertension, and I've been here with Godfrey Ochieng, who's a clinician, and he's helped us know what is hypertension, how we can live and prevent ourselves from contacting this disease. As he says, this is not a death sentence, and your health is your wealth. Wow. I have been your captain, Marvel. Till next time. Bye.